Hello, my name is Dr. Mel Eunice and I will support you if you're experiencing domestic violence.
Hello, my name is Fiona and I will support you if you are experiencing domestic violence.
Hello, my name is Valerie and I will support you if you are experiencing domestic violence.
Hello, my name is Margaret and I will support you if you are experiencing domestic violence.
I know I felt like this before. Now I'm feeling it even more because it came from you.
Hello, my name is Sarah and I will support you if you're experiencing domestic violence.
Hello, my name is Dr. Nass and I will support you if you are experiencing domestic violence.
Hello, my name is Louise and I will support you if you're experiencing domestic violence.
Hello, my name is Anne-Marie and I will support you if you are experiencing domestic violence.
Hello, my name is Margaret and I will support you if you are experiencing domestic violence.
Hello, my name is Orla and I will support you if you're experiencing domestic violence.
Impossible to ignore. Impossible to ignore.
Hello, my name is Emmett and I will support you if you're experiencing domestic violence.
Impossible not to do.
Hello, my name is Breda and I will support you if you are experiencing domestic violence.
Hello, my name is Veronica and I will support you if you're experiencing domestic violence.
Don't hurt me. You're what I couldn't find. I totally amazing mind. So
Hello, my name is John Higgins. I'm the Professor of Obstetrics and Gynecology and the Clinical Director for the Ireland South Women and Infants Directorate. We will support you if you are experiencing domestic violence.
We are West Cork Women Against Violence and we're here to support you if you're experiencing any form of domestic abuse.
Hi, my name is Margot and I work in the Sexual Assault Treatment Unit and I'm here to support you if you experience sexual violence.
My name is Sinead and I work in the Sexual Assault Treatment Unit and I'm here to support you if you're experiencing domestic or sexual violence.
Louise and I work in the Sexual Assault Treatment Unit and I am here to support you if you experience domestic or sexual violence.
Hi, my name is Deborah and I and my colleagues Mary and Angela will help you and support you if you are experiencing domestic violence.
Hello, my name is Jennifer and I work with Coonley Refuge and I will support you if you are experiencing domestic violence.
My name is Mary Crowley. If you've experienced any form of sexual or domestic violence and need counselling or support, please contact us.
Hello, I'm Carol. I'm with Manafasa and I'm here to help you.
Hi, my name is Ruth and I work for Yana Domestic Violence Project in North and East Cork and we're here to support you if you're experiencing domestic violence.
We need air to breathe. We must breathe in order to stay alive. Our lungs transport the oxygen that we inhale when breathing into our blood cells. This blood is then carried to the heart. The heart works as a pump for the body, transporting the oxygen to all other organs. When we smoke, we are filling our lungs with over 7,000 chemicals, including nicotine, the addictive substance which fools the brain into feeling happy for several minutes. It's a deadly poison in high doses. Tar, the ingredient which stains the teeth and fingers. It gathers as a sticky brown substance in the lungs. Carbon monoxide, a poisonous gas which lowers the blood's ability to transport oxygen. Formaldehyde, radioactive chemicals. Toxic metals, which are used in the making of batteries, paint, pesticides and steel. And poisonous gases, which may be used in the making of lighter fluid, household cleaners, and even chemical weapons. These chemicals are transported to tissues all around the body when we smoke. Smoking increases the risk of cardiovascular diseases such as heart attack, stroke, and angina. And respiratory diseases such as chronic obstructive pulmonary disease, emphysema, and chronic bronchitis. Smoking also raises blood pressure, stains skin and teeth, and can even contribute to fertility problems. Smoking can be harmful to your baby while pregnant. Lung cancer is the most common cancer caused by smoking. 1 in 5 heavy smokers will die of lung cancer. Smoking 10 cigarettes or more a day qualifies as heavy smoking. Smoking can also result in cancers of the throat, larynx, nose, mouth, bladder, esophagus, and pancreas. As well as causing long-term diseases, smoking also weakens the immune system, meaning it's easier to catch diseases and takes longer to recover from everyday illnesses. Smokers will spend on average 2 extra days in hospital per visit than non-smokers. All in all, smokers lose an average of 10 to 15 quality years of life. 85% of the smoke from a cigarette is consumed by others. The children of smokers have higher rates of admission to hospital and spend an average of 3 extra days per visit in hospital compared to the children of non-smokers. Children are also more at risk of sudden infant death syndrome, respiratory diseases such as asthma and bronchitis, and ear infections. Giving up smoking saves your life. Within 20 minutes of quitting, blood pressure drops and pulse rate and body temperature return to normal. Within 48 hours of quitting, the ability to taste and smell improves. And within 3 weeks, lung function and circulation improves. After 1 year of not smoking, the risk of sudden death from heart attack is almost cut in half. Smoking is also an expensive habit. Quitting could save you thousands per year. Smoking 10 cigarettes a day costs €1,825 per year. Cork University Hospital is a smoke-free campus and is committed to helping you stop smoking. Smoking cessation officers are available to advise and support you. Willpower is no match for addiction. Studies have shown you are more likely to quit using a smoking cessation product. Smoking cessation products include nicotine replacement therapy, NRT. Examples include a patch, gum, or inhaler. Alternatives including tablets like Champix. Please note that most of these therapies, to be effective, need a minimum of 12 weeks treatment. The HSE advocates the use of dual NRT, such as a patch and inhaler combination, as the recommended first-time treatment. Your smoking cessation officer can advise you on all of these options. Quitting is 4 times more likely to be successful when the individual receives support. If you have any questions about nicotine replacement therapy at CUH, please contact the Smoking Cessation Officer at 021 4922 280 or 087 121 9633.
I'd like to discuss with you your pain relief options that are available to you once you're admitted to hospital. Your midwife will meet you and discuss your birth preferences and assess your stage of labour. This will help determine what type of pain relief is most appropriate for you at this time. Firstly, I'd like to talk to you about pethidine. So pethidine is an opiate similar to morphine, and it's given by injection into your thigh. It can make you feel a little bit nauseous, so we would always give you an antiemetic or an anti-sickness injection at the same time. It's very helpful in the early stages of your labour, and it can relieve a lot of the intensity in your contractions. It can make some mums feel a little bit drowsy, but sometimes this can be just enough to allow you to rest and relax between the contractions and allow your labour to continue throughout. Pethidine can also make your baby a little bit sleepy. And so for this reason, we would be reluctant to give you pethidine if we felt that your baby's arrival was imminent. To determine this, sometimes we can assess you prior to administering the drug, just to be sure. Here in the CUMH, we have gas and air available in all of our birthing rooms. Also known as Entonox, it's a mixture of nitrous oxide and oxygen. It's a short-acting drug and it has no effect on your baby, and it is perfectly safe to take this if you've already had some pethidine. The drug itself is self-administered through a mouthpiece and tubing, and it takes just a few seconds to take effect. Your midwife will encourage you to take a deep breath through the mouthpiece at the start of your contraction and then exhale slowly. You continue to breathe like this until the pain has passed. One of the advantages of using gas and air in your labour is the technique is the same as you would have used in your breathing techniques for the earlier part of your labour. The tubing for the gas and air is long, so you'll still be able to mobilise around the room. You'll be able to use your birthing ball, change positions, and generally mobilise to where you find yourself most comfortable. Gas and air is also available in the birthing pool. An epidural is another form of pain relief that is also available to you here in our birthing suite. This is a procedure that's performed by an anaesthetist. And should you decide to have an epidural, the anaesthetist will come and explain and discuss this procedure with you prior to commencing it. An epidural is where a small tube is inserted into the small of your back. Through this tube, a local anaesthetic is inserted by the anaesthetist, and this local anaesthetic numbs the nerves that carry the signals to the part of the body that feels pain. Most women will find that an epidural is a very effective form of pain relief in their labour. However, it does make changing position very difficult in labour, and it is not possible to mobilise any further. Throughout the rest of your labour, you will require to have continuous monitoring of the baby because there's a continuous infusion, and observations will need to be carried out. A urinary catheter will be inserted and IV fluids will be required also. An epidural will mean that you are confined to your bed for a good 6 hours after your baby is born. It is important to remember though that in any of your choices regarding your pain relief, your midwife is there to support you and help you make the appropriate decision. Here in Cork University Maternity Hospital, we also have a birthing pool. At present, we do not conduct water births and request that you would exit the pool prior to your baby's birth. Water immersion has been found to be very useful in managing pain in labour. The warm water helps to relax the muscles between contractions, and also the water supports and makes moving and changing position much easier. There is evidence to suggest that the use of water in labour leads to shorter labours. However, your midwife would not recommend the use of the pool if you have had a pethidine injection in the preceding 4 hours. However, gas and air is available. The pool is available for all women that are experiencing a low-risk pregnancy, and your midwife will assess your suitability for the pool prior to entering it.
Babies are always to be placed on their back when they sleep, whether it be day or night. It is the safest position for your baby because it reduces the risk of sudden infant death syndrome and also suffocation. The safest place for your baby to sleep is in your room, in their own cot for the first 6 months. I'm now going to demonstrate the positions of which you should put your baby in safely to sleep. Baby should always be placed into the cot with their feet to the foot of the cot. And the reason for this is it will stop your baby, preventing them from wriggling underneath the blankets. So what we recommend is that the baby's feet are to the foot of the cot so they have nowhere else to go. So it could be the cot, it could be the Moses basket, it could be the crib. It's whatever place your baby is sleeping. So feet to the bottom. Blankets then should be tucked loosely across at shoulder level. The other thing we do recommend is that if you can use the cellular blankets. So the cellular blankets are the ones with the holes in them, and they're aerated so that more air can go down through it and help your baby's temperature to be maintained and cool themselves down if they do get too hot. Another thing to remember is that there shouldn't be anything else in the cot. So no fluffy toys, nothing that can cause a suffocation risk, so no bumper pads, toys, or any extra garments in the cot. Your baby's head should always remain uncovered because, again, if your baby gets too hot, they can lose some of their temperature out through the top of their head, and that helps to prevent them from overheating. If you do decide to use a sleeping bag, make sure that the sleeping bag is the correct size for your baby. So for this baby, we would be using a small newborn sleeping bag. You'd have a low TOG quality, and you'd ensure that the bag had no sleeping bag had no hood. Something similar to this, where their sleeping bag would fit the baby's size, that their arms could be out freely, and that it's a low TOG quality. We don't recommend co-sleeping with your baby as there is an increased risk that the baby may overheat. Sometimes as well you may roll over onto your baby and there's an increased risk of suffocation. It is important not to sleep with your baby in the bed. If you are a smoker, if you've taken alcohol, if you've taken any drugs, be there illegal or illegal drug use, anything that would make you drowsy, or if you're extremely overtired. We also recommend that you do not sleep with your baby in the bed if they are less than 3 months old, if they were born at before 37 weeks, or if they weighed less than 2.5 kgs. Cot death doesn't automatically happen in a cot. It can also happen in a bed, a pram, or a car seat. It is important to maintain the safe sleep positions no matter where your baby sleeps, so always remember to keep your baby on their back. But never leave your baby unsupervised in a sitting position such as car seats, bouncers, or anything similar like that. We don't recommend that the baby is left sleeping in those unsupervised. So normally the room temperature should be anything between 16 to 20 degrees. And so you judge it by yourself. If you're comfortable in your room environment, the baby should be comfortable as well too. Use the cellular blankets, as I said, feet to the foot of the cot, blankets loosely across the shoulder level, nothing covering the baby's head. And if your baby seems unwell, seek medical attention.